Certainly. So my name is Morgan Hungenberg. I'm a third-year family medicine resident through the University of Colorado program, and I'm the first class track. So what that means is I did my first year of my intern year in Denver, and then I'm finishing my last 2 years of training in Fort Morgan. For the last month, I've been going back and forth between here in Denver. I'm in Fort Morgan now, or Brush rather. So I had already scheduled an elective in the ICU in Denver in early April. So I went and did that for 2 weeks and then was back in Fort Morgan working at both the Salud Clinic, seeing patients there in person and via telehealth. And then at Colorado Plains Medical Center, I did a few days on inpatient there with the hospitalist. This month, I am working on the family medicine service in Denver. Like I said, it was already scheduled, same with the last rotation, so I just keep going. But this week I'm back in Fort Morgan, seeing patients via telehealth through Salud and in clinic.
So you say telehealth and in clinic?
Yeah, so we're still seeing our OB patients in clinic and then well-child checks if they're under a year old, so they don't get behind on vaccinations, weight checks, and that sort of thing. And then our OB patients, we're seeing them if they need something done, like their tetanus vaccine, or if they're getting close to deliver, we're still seeing them in clinic.
And the rest of your outpatient business, you're able to do. Obviously, can't do all of it by telemedicine. What percentage would you say you're doing by telemedicine?
I think right now, like 75% of the clinic is telemedicine, is what we're doing. And I think that's true of my schedule too. I'm usually in clinic one half day a week.
Say that again. What percentage? This is breaking up a little now and then.
Yeah. So I think 75% of our visits now are telehealth and about 25% in clinic in person. And I'm spending one half day a week in clinic, usually with 2 or 3 telehealth sessions a week.
And in clinic, what sort of, besides the OB and the well-child checks, what sort of problems are you seeing there?
If patients need to be seen for other reasons, I think we're opening it up to procedures, so IUDs, Nexplanons. If somebody needs to be seen and they're not having any symptoms of fever, shortness of breath. So like I had a patient that I referred who was having a rash, and I was like, I can't really evaluate this over the phone. So I had to send her to the clinic. We do have a tent outside the clinic too, where we're seeing patients who are having symptoms of fever, cough, shortness of breath. But we only have one provider doing that right now. And that's our medical director. Rebecca Bull, who's a PA, is exclusively seeing patients outside in the tent. But we've decided as a clinic we would only have one provider to do that, and we would rotate between providers.
Have you, has she diagnosed anybody with coronavirus?
Yeah, we're doing testing as of, I think, 2 weeks ago through the tent in the parking lot. And I've had multiple patients on my schedule for telehealth just result visits that were coronavirus positive.
And how many who've gotten sick?
That's a good question. From the ones I've seen, it's about 50-50 that are having symptoms like fever, the shortness of breath. Other people are having sore throat, diarrhea, or they were just known to have contact with someone who tested positive, and then they too tested positive.
Okay, and any people who've wound up in the hospital?
So working here in Fort Morgan at Colorado Plains, I was on the inpatient service, and we would get at least 1 or 2 admissions a day of coronavirus positive people.
Are they winding up on vents?
Let's see, I was on for, I think, 5 days. I think 3 or 4 of the days we transferred somebody out because they needed to be placed on a vent. Yeah.
So you send them up to Denver to see you?
Denver or Loveland Medical Center of the Rockies took a bunch of them also.
Okay.
Yeah.
Good. And in the meantime, you're going back and forth to Denver and doing rotations there.
Yeah.
Compare your experience, and you said you worked in the ICU there?
Yeah, I worked in the medical ICU, so not with the COVID patients, just for the patients that need ICU level care for other reasons. But I know that they had scaled down they have like several ICUs at University Hospital, and they had been taken up. At least two of the ICUs were for COVID only patients out of four
Mm.
ICUs. So the one I was in was for people without coronavirus, but still needing ICU level care.
So obviously that's a very, very different environment from from University Hospital to
Yeah,
Colorado Plains Medical Center. Um,
yeah.
so I'm asking you to describe uh, everything you can about it in about 3 words. Seriously, can you say something about how different they felt? How it is
Um,
confronting this where you are
yeah,
versus how people are, even if they're not
yeah,
taking care of COVID patients in Denver.
yeah, yeah. So the biggest issues in the ICU was, yeah, we didn't have COVID patients, but we had COVID rule out patients. So it was like, how do you take care of those people while taking care of your people that are also very ill? You don't want to expose them potentially to COVID if you have a patient that's a rule out that you don't know. And same with Colorado Plains because it's a small hospital with non-COVID patients. So it was like we would see our non-COVID patients first and then go into the COVID rooms later and like limit our interactions with COVID patients, not physically touch them if we could avoid doing an exam, just to minimize contact with them, which I think is hard on us and hard on patients
Mm,
to not have that because as doctors, it's really important to be able to do that exam and to interact with our patients and to touch them and to
mm.
not be able to do that was really hard.
Yeah, I my one of my children is a therapist in
Mhm.
Seattle, and
Yeah,
his practice seamlessly went from face to face to interactive video. I don't think
yeah,
he lost any clients, but he said, and his colleagues say the same thing. It's just a strain. It's a strain not being
yeah,
able to be in the same room. Uh,
yeah,
people. Um, yeah.
yeah, absolutely it is. I think the patients feel it too. Yeah.
Yes. Yeah. And tell me, how is it different working with the staff at CU or in the institution at CU versus
Yeah.
in Fort Morgan?
Um, I don't know. Staff both places is great, really supportive. I think
Mhm.
maybe a little more of a strain for the rural area in Colorado Plains just because they're having to do it all.
Right.
Um, and also, it's a struggle to know if someone needs to be placed on a ventilator, are we able to keep them? Do they need to be transferred to another facility?
Mhm.
Do we have enough ventilators? Whereas I feel like at university, it's like, yeah, we could get more easier, having more resources in Denver than in Fort Morgan. Um, so that was always the question is, do we need to transfer the patient? Can we keep them here?
Mhm.
Because also it takes a bit to set up a transport. It's not
Mhm.
a quick thing. Whereas in Denver, if you're in the university hospital, you could just transfer them to another part of the building. Whereas out here, it takes at least 30 minutes to set up a transport, and then you got to get the transport team. And yeah,
Yeah. And I understand, I think it was Sandy who told me that you're planning to stay and practice
hmm
in Fort Morgan, right?
yeah,
Um, so has this made you question that choice at all?
no, not at all.
Okay.
I like rural areas. I went into it knowing there would be fewer resources than like the academic center. But I think it makes you a stronger doctor if you have to learn how to work around those limitations.
Mm-hmm. I
And I
agree.
think the patients are understanding of that too,
Yeah.
knowing that they live in rural areas. They're not going to get the tertiary level of care, but they're okay with that. The hard part is talking to patients and transferring to another facility, knowing that their family can't go with them or unclear how long they're going to be at another facility. And I think that's harder for people in rural areas to
Yeah.
accept than like in Denver.
Well, good for you. You've got it about right. For sure, the hardest thing, and I have years and years of rural practice under my belt, and I practiced in brush for 15 years, for example.
Yeah.
Um, and I think the two hardest things are lack of depth.
Mm-hmm.
Just you may have about everything you need, but one person gets sick or one of your ventilators gets used, and man, what do
Yeah.
you do next? And the
Right.
other thing is, which I think is wonderful about your rural track program, rural training track, um, is a feeling of isolation. And
Yeah.
that's one thing that the rural training track does, is it connects your staff
Mhm.
to,
Yeah.
in many, many ways.
Yeah.
Yeah. Well, that's good. What's been hardest about this for you? Most challenging?
Um, Most challenging. I think it's just the same thing everyone's dealing with. We're learning how to do medicine in a completely different way. Even if you're in the hospital, like I said, not being able to touch your patients or having that fear of, I think a lot of people talk about it, fear of what if you were to get infected or potentially take it home to your loved ones. Or, I'm still in clinic seeing moms, pregnant moms and babies, like what if I were to transmit it to them? I think is a
Mm.
huge fear for everybody. Yeah.
So when you're working in clinic, not the COVID clinic,
Yeah.
what kind of personal protective gear do you wear?
So we have a lab coat that is issued by the clinic. It's kind of like a plastic material that's easy to clean. We wear face masks, not N95s, but regular face masks, surgical masks. And then we have a plastic visor we wear also, and then gloves.
Mm.
We don't allow anyone who's having any COVID symptoms to come into the clinic. So it's mostly healthy people. And the patients all wear masks also.
Mhm. And I suppose you just clean, clean, clean.
Yeah, pretty much. I try to clean my stethoscope after every patient if I can. Yeah, and wiping down work surfaces and everything else.
What do you use to clean your stethoscope?
We have specific antiviral wipes that we use.
Good.
I can't remember what they're called.
I used to clean mine with an alcohol swab, and it always seemed like it wasn't nearly.
Yeah, yeah, uh-huh.
Yeah. Um, and long ago, I quit wearing a tie, largely
Yeah,
for personal preference. But if you ever noticed, your one's
yeah,
tie dragging across the wound, and stuff
yeah,
like that. So,
uh-huh.
do you know that in England, physicians cannot wear long sleeves?
Really?
They're mandated
That's
not even to
super
wear long sleeves.
interesting.
Well, and when the studies show, of course, the sleeves carry all kinds of
Oh,
schmutz.
yeah,
So,
yeah, uh-huh. Same with our white coats. I like never wear my white coat if I don't have to.
yeah.
The same thing. It's a huge carrier of germs.
I left mine behind when I was an intern, and it was handy as an intern to have
Yeah.
pockets in it. I could pull it out.
Yeah. Uh-huh.
But yeah. Um, so how do you feel? I know there's some strain. Um, what are you doing to keep yourself intact?
I have a really supportive family and husband, so that's been good. So they've been helping and then just trying to take like some downtime every week to relax
Uh-huh.
and do other stuff. We helps to just do little projects and stuff.
Uh-huh. Okay. What kind of projects?
We painted. So we painted this room a couple weeks ago to be our
Uh-huh.
office. What else have we been doing? We're replacing like all the lighting in the house. Yeah, our house was built in 1914, so it needs some updating.
Wow. Wow.
Yeah.
So I assume once you're an employed doctor, you're going to upgrade?
I don't know
Uh-huh.
house. So yeah, we'll do some upgrades on the house though for sure.
Oh, okay. So you're not looking at like up on Doctor's Ridge there by the country club? You're not
No. No.
Okay. You live in town in Fort Morgan?
In Brush.
In Brush?
Yeah.
Well, the
We
the
couldn't find a house in Fort Morgan, so we found one in Brush we really liked.
yeah. Well, real estate was always easier to come by in Brush.
Yeah. Uh-huh.
Um, okay. Do you live right in town in Brush?
Yeah, we live like a block from downtown.
Uh-huh.
Pretty close. Yeah. We're in walking distance like all the restaurants and stuff, the
Yeah.
post office and the hardware store. So it's
Oh, yeah.
nice.
Those are some nice neighborhoods up there by the library
Yeah.
and stuff.
Yeah, kind of by
Yeah.
there.
Oh, that's good. That's nice.
Yeah.
All right. Um, and so how is your husband handling this?
He's doing pretty good. He's in the Air Force and he's in school right now. He's doing online class, so not a lot has changed for him, because he's still doing his online classes. But I mean, being in the military, that too. He's in the National Guard, so he, as in school, can't be deployed or
Mm-hmm. Yeah.
called to work. A lot of uncertainty.
Mm-hmm. So he's at home.
Yeah,
And
yeah. So he's hanging out at home.
pardon? What'd you say?
Hanging out at home for the most part. He's hanging out at home.
Okay. Um, how much are you working now? How many hours would you estimate?
It depends on if I'm in the hospital or not. Um, if I'm in Fort Morgan, it's probably still about 40 hours a week. In Denver, it goes up to 60, 70 hours a week.
Mhm. And how much were you working in Fort Morgan before the pandemic?
Depended on the month, but about the same. I don't think my hours have changed all that much.
Okay, about 40 hours a week.
Yeah.
And you're a resident. It doesn't sound like you're suffering enough.
Don't tell my program director that. He probably thinks the same.
Okay, who is that?
Dan
Is that
Burke.
Dan? Yeah,
Yeah,
well, he's a good guy.
he is a
Yeah.
good guy. Yeah.
Did you go to CU for medical school too?
Didn't. So I'm a DO. So I went to a DO school in Arizona.
Uh-huh. Okay. Yeah, I worked as Deutschman's sidekick for a while too.
Did you?
Yeah, so
Yeah. He's the one who told me about the rural track. When I was a med student, he was helping me and
that's
he
good.
was like, "Oh, by the way, we're starting a rural track. You should know."
Oh, that's good.
Yeah.
When I was on the faculty at the residency in Greeley at North Colorado Family
Hmm.
Medicine, I'm the
Yeah.
person who put together the rural training track in
Yeah.
Ray, and
Uh-huh.
also the alternative training track at Sunrise. So um, I'm a great fan of what you're doing.
Yeah. Yeah.
It's the best
Yeah.
training you could get, and you know that.
Yeah. Yeah. I agree.
Yeah,
Mhm.
yeah. Um, how do you think this has changed your outlook on your career? I mean, you're going to be doing more telemedicine, it seems.
Yeah. Yeah.
But what else has changed about this?
Um, so yeah, I see us doing more telemedicine for sure. And then I think it's interesting because I felt like before as a doctor, I relied so much on my physical exam and physically seeing the patient. And now you have to be so much better about taking your history and paying attention to those cues that the patient gives you when all you have is the phone,
Mhm.
um, which has been hard for me. Yeah.
And you've been doing just phone and not video conferencing?
No, we've got the software to do video conferencing, but we haven't rolled it out yet.
Okay.
Yeah.
Um, and I assume there a lot of your patients don't have broadband enough anyway
Yeah.
to be able to be able to do this.
Yeah. Probably not.
I read a study a few years ago, maybe 5 years ago or so, that was done in Britain, and they took seasoned GPs and found that they had the diagnosis right.
Hmm.
It was something like 70% of the time after the interview,
Yeah.
and 90% of the time with the interview plus physical exam.
Yeah. Uh, I could see that.
And how does
Yeah.
that compare to where the emphasis has been put in medical training?
That's a good question. I think because of so much technology, we're getting away from the physical exam.
Yeah.
Like we do a lot of training now with ultrasounding. And so a lot of physicians are like, I have hung up my stethoscope. I just use ultrasound.
Uh-huh.
So I don't know. I think because of this, we might get back to more physical exam.
Uh-huh.
Yeah.
Yeah. Um, oh, so I have to ask you, is Hungenberg your name, or did you get it
Yeah.
from your husband?
No, it's my name.
Are you
My
from
maiden
Greeley?
name.
The Hungenberg
I'm from
family?
Greeley.
The produce family?
Yeah. Those are
So,
my dad's cousins.
okay. Years ago, and maybe you know this guy, a phlebotomist at the blood bank, a tall, good-looking guy named Hungenberg. I can't remember his first name now.
Huh.
And he wound up being a firefighter. I think north, maybe in Eden.
Oh, okay.
I'm sorry, I'll turn that off.
You're okay.
Um, anyway, I wondered what happened to him, but it doesn't sound familiar, huh?
Um, I don't know. I have some cousins that are all very tall.
Uh-huh.
All played baseball at Eton, and now I think most of them either work for the produce company, or I have a cousin who's a doctor of physiology in Tennessee. So it may have been him, Eric,
Uh-huh.
but
Yeah.
yeah, I don't keep track of them that
Might have been
well.
Chris or something. Anyway, okay.
Yeah,
I can't help. You know, I mean, it's in Northeast Colorado, it's 2 degrees of separation at the most.
yeah. Oh, absolutely. Yeah,
And no, I've lived in Greeley since 1985, so
yeah.
there you go. I never know. What high school did you go to?
So I graduated from Frontier
Uh-huh.
Academy, the charter school.
Sure. Okay.
Yeah.
Anyway. Um, so when this is, let's jump ahead some years.
Mhm.
What do you think you'd tell your children about this time? I mean,
Mm,
that's a big assumption.
yeah,
Maybe you don't want to have kids, but anyway, if you had kids, what would you tell them in 20 or 30 years?
interesting. That's a good question. We've all been talking about that as residents, like we're going to
Uh-huh.
be those old attendings that are like, I remember when.
Uh-huh.
Um,
I'm one of
yeah,
those.
I don't know. Yeah. So, yeah, I don't know. I think it'll be interesting to see how medicine changes after this.
Mhm.
And we'll probably tell them like that was a very much a pivotal point in medicine when we started reevaluating everything we do.
Mhm.
Yeah.
Yeah. How are you doing with the underserved? Well, and you're at Sunrise, so you see the underserved
Yeah.
community, a large percentage of your patients.
Yeah.
Um, what have you learned about them and about medicine through this?
Mhm. Um, I think things that we already kind of knew, but I didn't realize how much that was the case, like poor health literacy. Like I had a patient who was discharged home from the hospital, and I called in for a hospital follow up visit. And I said, you tested positive for coronavirus. And he was like, oh, yeah. But in the background, I could hear children. His son took over the phone, and I was trying to talk to them about, you need to limit contact with him. But it's like, I don't think they fully understood that. Just being in a multi generational family and home, it sounded like they were all just right in the same room together. And I don't know their living situation. Maybe that was, the only space they had, but it just seems like it's so much harder to get that across. And they were Spanish speaking, so I think just showing those discrepancies, like people with low health literacy, also language barriers, maybe they're not getting as good of information as we are as English speaking people.
Mhm.
So definitely seeing that. Um, yeah, and then just patients coming into clinic, also with English as their second language, not wearing masks, or not being fully aware of like our procedures and stuff, or how it's supposed to work. I've had patients call saying like, hey, I'm standing outside the clinic, and I'm like, this was a telehealth visit. um, I'm just supposed to call you on the phone, and they're like, I don't know why they're not opening the door and letting me in. So I think we're just seeing that a whole lot more now.
You have certainly chosen a challenging career path.
Yeah.
Not just family medicine, not just rural family medicine, but rural, underserved, multilingual
Yeah.
family medicine.
Mhm.
So that's how you are, huh?
Yeah. Um, I'm the first medical doctor in my family.
Uh-huh.
And the whole point of going to medical school was at a farming family, wanted to do rural. So
Uh-huh.
I always felt like I didn't go to medical school just to like live in an urban area and take care of upper class people. But the whole point of going to medical school was to help underserved people. Um, and I kind of like the challenge of it too, I think.
Mhm.
Um, having that language barrier. I speak some Spanish, but not enough. So definitely adds complexity to your day, which is challenging, but can also be really rewarding too.
Yeah. I speak fluent Spanish. I was just lucky enough to pick that up earlier in my life. And so that I had that problem of the language barrier, that's been one.
Yeah.
But when I worked for a while, for some months, at the clinic that serves the beef plant,
Uh
uh,
huh.
the Marathon Clinic.
Yeah. Uh huh.
Uh, so we not only had Somalis there,
Yeah.
but there are four different Somali languages, and so we had to use
Mhm.
the language line and know which language it
Yeah.
was they were speaking.
Yeah.
That was
Uh
hard.
huh. It's so hard. And we
Yeah.
have a lot of people from Guatemala that speak Spanish as their second language,
Yes. Yeah.
and they speak like the Indian dialect, which
Yeah.
we can never find an interpreter for. So the interpreters are always like, I don't think they speak Spanish. I'm like, they do speak Spanish. It's just different.
Yeah. Yeah.
Yeah. We have the Somali speaking people. We have Tigrinya, a lot of French people speaking people also that are from Africa
Uh-huh.
that work at Cargill. So it's interesting.
Yeah. So what other things, what would you like to say? You understand that what we're doing is we're creating an archive, and it will be open especially to
Yeah.
researchers and historians. We hope years from now, also to the general public, for anybody who just wants to learn. Um, so this is sort of your chance to tell the future what you think
Mhm.
they ought to know about these really extraordinary times.
Yeah. Mm. I don't know. I think the biggest thing that I've been really amazed by is just the amount of support from the communities and our patients. Every single family that I talk to in the hospital or in the clinic thanks me for what I'm doing, um, and has just been so supportive. And I think that's something we don't always see, especially as residents. So it's been really a unique time. And also just like everyone's a willingness to adapt and learn new things and, you know, offer up support or services like my co-residents, our faculty, staff at the clinic, staff at the hospital. Nobody's like complaining. Everyone just really stepped up. And we've all worked together really well. And that's been amazing to see.
That's wonderful. I wonder, have any people, or any of the professionals you work with, or um, step back out of fear? Most everybody has stepped up. I was talking to
Yeah.
somebody the other day who said, "Yeah, this happened, and we saw who ran toward the emergency and who ran away."
Yeah.
Um, have you had some people run away too?
I haven't seen any or heard of any, really.
Good.
Yeah.
That's really good. Yeah.
Yeah. I think more people have stepped up than were like needed, especially in our clinic. We had a lot of people stepping up and saying, I would love to, just don't have enough
Hmm.
work for them to do. So,
Yeah. Has Sunrise or the hospital have had to do any layoffs? I know a lot of
um,
places, a lot of
yeah,
practices and hospitals are doing that because they're not
yeah,
doing their kind of day-to-day stuff.
yeah. At our clinic, a lot of our front desk staff has been like they just don't have work for them to do, so they've been staying at home. We only have 3 medical assistants per day in clinic. The rest work from home and make follow-up phone calls or call our telehealth patients before we see them. But there's just not enough work to go around. we've definitely seen that. And it's been hard. And we were also in the process of hiring like a new behavioral health provider and person. It was kind of like put on hold, I think, for now. And then hiring new MAs that got put on hold. Um, I have co-residents who were set to start jobs in the summer, and those have been put on hold or job offers rescinded. So that's been really hard to see. Yeah.
It, who knows how this is going to all shake out.
Yeah. Yeah.
Um, I hope we're the stronger for eventually, the stronger for it.
Yeah.
And here's a
Do
really
too.
unfair question. Well, first of all, there have been, I understand, large epidemics at Ebenezer, the nursing home, and at the
Mhm.
beef plant, at the Cargill beef plant.
Yeah.
Have there been any other foci of epidemic?
Um, no, we have Leprino, which is the cheese plant. They tested all of their employees and shut down for a few days. I, as a resident, patients at the Valley View Nursing Home, and
Uh,
so we have not been able to go see our patients. But our faculty who works there, we've been doing little, just sessions talking about, even though we're not able to be there, like how would you treat someone if they develop pneumonia in their nursing home? And so he's been keeping us updated. He said, luckily, they have not had an outbreak, but it's definitely on their radar and something that they're worried about
Sean was
because
the
of
first
Ebenezer.
person I interviewed.
Yeah.
That
Yeah.
was a couple of weeks
Uh
ago.
huh.
And then
Yeah.
Tamara, too, which was,
Yeah. Uh huh. Yeah. They're
um,
both like phenomenal.
I know,
Yeah.
they're wonderful, wonderful people.
Yeah.
Um, so can you tell, have you reached the plateau or the peak of incidents, or is it
Um,
still going on?
I don't know. I think in Denver, it seems like everyone's talking that they've reached the plateau, like at university. But I think out here in the rural area, I think we're going to be a little bit behind. And that seems to be what's happening. But I don't know for sure. Yeah. We saw like a peak of testing last week at Salud just because we started offering testing and it slowed down this week. But I think that's because everyone who worked at like Cargill or had a known exposure was coming in to get tested last week.
Mhm.
So there was going to be a rush. Oh.
Is the marathon clinic staying open now?
Yeah, and I actually heard that they started their own testing. So we're going to see less people for testing because of that too.
Hmm.
Yeah.
Ooh, I could interview somebody from that clinic.
Yeah,
That's a
that would
good
be good
idea.
because
Now,
they were probably seeing more than we are
the staff
at
there
this
has
point.
turned over since I worked there, so I'll have to figure out who to call, but
Yeah.
I might just do that. Um, and I've been reading, it's interesting to see people in general are saying they want to go slowly
Yeah.
in opening back up, slower
Hmm.
than some of the politicians are saying. I'm sure you've read
Yeah.
about the kerfuffle in Weld County.
Yeah. Yeah.
What are people saying? What's it like in Fort Morgan?
Hmm. I don't really know what people are saying. It seems like the biggest part is agriculture. Like that can't really stop. So
Right.
I think that's everyone's big concern is like, how are we going to keep working? And I think we have a lot more blue collar people, blue collar workers out here because of like the Cargill and
Mhm.
Leprino. So a lot of people have just kept working. So I'm not entirely sure. Yeah.
You know who I feel sorry for is the beef producers,
Yeah.
because with shutting down all those plants,
Yeah.
they have all this cattle that they still have to feed. I mean, they're not going to
Yeah.
just kind of shoot them and bury them in a ditch, I hope. But what are they going to
Yeah.
do?
Yeah. I don't know. That's a good question. And my dad is working in agriculture right now, sprayer, and he still got to go out and spray fields. We can't just not do that. The farmers still need to get their crops in the ground and get things going. So it's interesting.
Yeah, at least the farmers have very few opportunities for contagion,
Yeah. Uh-huh.
because they're all out there, especially around around these parts.
Yeah.
Uh,
Yeah. My dad's been out like Gray, Holyoke. he's like, no, I'm still working every day, going out there, getting stuff ready. So
Did you say he's an aerial sprayer?
no, he just drives the tractors with the sprayers
I
and
see.
mixes up like the chemicals and stuff. So
Well, it's been wonderful getting to know you a little bit. Um, I hope someday our paths cross. You know, there's still nothing like
yeah,
actual, need I say, face to face.
yeah, that
Um,
would be nice.
Yeah. Um, Gosh, and I just wish you the best.
All right,
Okay.
thank you.